In Minneapolis, Minnesota, I interviewed Roberta Fernandez, a pretty amazing woman. With my interest in healthcare, I also thought it was important that we look at how patients can help reduce the cost. And so I interviewed Roberta, who did something really amazing after a double knee surgery that not only reduced her pain, but reduced the financial cost for herself and her insurer. This is a hopeful story for anyone facing surgery. Bon appetit.
I do, and I will give you the recipe. It's for lasagna, and it is wonderful. It's a recipe that I got, I don't know, some cookbook probably 30 years ago, and I have fine-tuned over the course of my life. So you can look for that on your website. Yes, my name is Roberta Fernandez, and I'm a certified consulting hypnotist. I'd love to share that. Thank you. My story starts a while back, but unrelated to my pain. I had an interest in hypnosis. I had been to a retreat where I had been hypnotized by a prominent person who was a therapist and uses hypnosis in their practice. And it was an amazing experience, and I was keenly interested in doing more work with this person, taking more classes. But I realized that I had to learn how to hypnotize people. I should anyway. So I came back home, and I live in the Twin Cities in Minnesota, and I found a hypnosis school here. Took an 80-hour class where I earned my certification. And in tandem with this, I've had many years of knee issues, and it was getting progressively worse. The hills up here were killing my knees, and my quality of life was really degrading to the point where I could hardly shop for groceries. So I asked my instructor if I could come in for a session with him to help me better manage my pain, because steroids weren't working anymore. I had exhausted all the traditional therapies, and I had no life, basically. So he said, sure. So I went in for a session expecting to be able to manage my pain, and I walked out of that office with no pain. And for 2 months before I ultimately had my surgery, I was pain-free. And I learned various techniques to help me stay that way when it would, rear its ugly head. The pain didn't go away. I just wasn't feeling it anymore. I would learn how to compensate and to put that back into the background. So I was very excited. I still needed surgery. My knees were shot. I still could not walk downstairs safely without my knees giving out on me. So the surgery was important for me to have, and I elected to do both of my knees at the same time. So as this grew closer, I started thinking about what I needed to do to prepare, and I created a tape for myself where I would hypnotize myself. And I visualized what this experience would look like, because I knew that I'd heard lots of horror stories. People thought I was crazy for doing both knees at one time. And, that was a concern for me too. But the constraints of my job and care afterwards said that was the best decision for me. So I started visualizing what I wanted that process to look like. And I wrote it all out, and I recorded it. And every day for 3 weeks prior to my surgery, I listened to that tape, and I would self-hypnotize myself. And it basically walked me through the process, the day of the surgery, how it would feel the first time I got out of bed, what it would be like to go to physical therapy, how would I deal with going to the bathroom for the first time, the whole bit. And I went through the surgery, I went through the rehab, I did it mostly without drugs at all, without pain medication, and it was exactly as I had wanted to experience it. And so it was a real eye-opener for me about how powerful our mind is and what we're really capable of doing. And it was a wonderful alternative for me in taking charge of my own health care and my own recovery. And it kept me feeling like I was in a position of strength and empowerment. I got out of bed the next day. Now they do get everybody out of bed the next day. They don't let you sit anymore. Most people who have both legs done, both knees done, are in leg braces. So you kind of, walk like a stiff-legged soldier, right? I didn't need those knee braces. I took about 9 Oxy the whole time. And for anybody who's familiar with pain, they shove those things down your throat every 3 hours. So once I left the hospital after 3 days, I had no drugs. I didn't need that. So my recovery was such that everybody was pretty impressed. I climbed stairs for the first time in 13 days. I'm currently 11 weeks post-op, and I am about where someone would be at 4 months. After 8 weeks, I had 2 weeks of rehab in a center where I had to stay because I needed the care. I couldn't move my legs for a while by myself. And after that care, I came right home, climbed my own stairs in my own house, needed very little care. My sister was here to help me a little bit with cooking and things like that were hard, and some house cleaning chores. But I've done really, really well. I had 8 physical therapy sessions. My degree of bend was already beyond expectations for the surgery. My extension was beyond expectation, in a place where people usually are at about 4 months. So the physical therapist basically said, there's nothing more I can do for you. Do your exercises at home and I'm cutting you loose.
What did the nurses and doctors think?
Honestly, they were amazed. The nurses had never quite seen anything like it. My first day of physical therapy, the first day, I walked. So I don't know equivalent. It was probably 150 feet to the therapy room, which doesn't seem like a lot to the average person, but believe me, it was far. I was exhausted, but I did it, and they were shocked. I went and took a shower by myself, standing up. It was quite amazing. A couple of them were so impressed that they asked me when I was recuperated if I would call them and help them stop smoking. So they were very, not only impressed, but they were really supportive. And that was shocking to me. When I went into rehab, the doctor there at the facility was an osteopath. He was very supportive of hypnosis as part of, my toolkit. The physical therapists were very impressed. They wanted to know more. They were all openly and admittedly surprised at how well I did. So it was really exciting. Fortunately, like a lot of alternative therapies, acupuncture, massage, Reiki, energy work, hypnosis is kind of thrown into that category. The sad part about it is that there's a lot of clinical studies that have been done on hypnosis, a lot of clinical evidence of its effectiveness. And there are certain people in the medical profession that use this as part of their therapy. Pain management is huge. Cancer patients, burn patients, child labor. That's a kind of a new upcoming thing, hypnobirthing. Women laughing through their labor, which is awesome. I would choose that any day. So there's a lot of interest in it. Unfortunately, there's not a lot of money to be made that kind of dictate what our choices are in the medical profession. No drug money to be made, no development money to be made. So there's not a lot of money thrown into research because people haven't figured out how to make a buck. My understanding of it is if you came to me as a practitioner to help you with pain management or whatever, it would not be covered by any insurance company that I know of. However, there are medical codes for hypnosis, which means that in some therapies, either prescribed by a doctor for pain management, perhaps, I would imagine around the cancer field with chemotherapy, there probably are some insurance companies who may fork over some dollars. Or perhaps with a psychologist who uses hypnosis as part of their treatment. Because the code is there, they have to disclose how they're treating. Whether it's actually paid for or not, I'm not totally sure. I think, though, that the more people talk about it, the more I would encourage all of you to ask your doctor if this can be part of their treatment program. The squeaky wheel gets the grease. And we've seen this happen in the chiropractic field where it's much more accepted and insurance companies do pay for it, where at one time that was alternative. So it's a matter of people asking. A cost, I charge $150 per session, which averages 90 minutes. However, for my clients who need more than one session, that would be much more affordable because they'd get a package deal for that. I think that there is big changes. The National Hypnosis Guild is very active in making those changes happen. They are encouraging collaboration between hypnotists who have practices like I do to work closely with doctors. I'm on my way in a couple of months to get a special certification to deal with practicing medical professionals so that I can better understand their world and they can better understand mine, and we can work more closely together and do that synergistically rather than competitively. So I think that there's lots of things that are indicating there's openness and trends to it. I have a daughter who is a researcher in Alzheimer's and concussion work with the brain. And through medical imaging, she shared a lot of research where they now know there's been medical evidence with hypnosis that they can see through these imaging machines now how different parts of the brain kick in, and they're understanding how hypnosis impacts the brain and that communication of pain. When my pain went away in my knees, it really doesn't come from my knees. That pain comes from your brain. That's what communicates discomfort. And so hypnosis allows you to turn that off to some degree. Maybe not totally, but partially, where you can control it. So if your pain was a 10, maybe now it's manageable at a 3 on a scale of 1 to 10. The pain's still there. The problem is still there. With my knees. It didn't go away, but I could function again because I didn't have that excruciating pain. So we're understanding a lot more about how our brains work. And hypnosis is all about working in the subconscious, that really deep part where we bury a lot of stuff our whole life to think and act and respond in certain ways. So whether it's pain or it's ability to lose weight or stop smoking or deal with childhood issues, you know, sleeping, fear of the dentist, all of these things can be significantly improved by using hypnosis.
Thank you.